an electrophysiologist at the Hartford Healthcare Heart and Vascular Institute. Thank you for being with me, Doctor.
Thanks for having me.
So tell us your thoughts about this recent study where researchers found heart damage among more than half of the 1,200 COVID-recovered patients.
Yeah, so this was an interesting study published in the European Heart Journal that involved over 1,200 patients from 69 countries, looking at patients hospitalized with COVID. And in those patients, when they did echocardiograms or ultrasounds of the heart, they found that 55% of patients had some form of heart dysfunction. When they actually removed patients who had known prior heart disease, they found that still 46% of patients had heart dysfunction or some sort of possible damage to the heart with the COVID virus.
Do we know why that is? And also, can people develop heart arrhythmias as a result of the virus?
Well, so we do know, and actually yesterday in Circulation, one of the leading heart journals, we know that patients who undergo cardiac MRI with COVID and a positive troponin, a blood test showing protein damage from the heart, those patients seem to develop scarring and tissue damage, and that probably impacts heart function.
And what about the patients who already have abnormal heart rhythms or maybe a pacemaker? Are they then a greater risk of developing COVID?
Yeah, that's a common question that we often get. So patients by themselves, if they just have an arrhythmia and no other comorbid or medical conditions, are probably not at any higher risk. But if they have associated conditions like diabetes, hypertension, congestive heart failure, which is often the case, then those patients are at higher risk of getting sick.
I know there's a lot of unanswered questions. We're still learning every day, really. But what are you telling your patients when it comes to precautions?
Well, I think that we've learned a lot as a country about how to keep safe. Certainly here in Connecticut, I think that we've all done a really great job. I tell my patients that we need to continue with the social distancing, wear a face mask when in public, and wash your hands when you're out and about so that you reduce the risk of contracting the virus.
Doctor, thank you so much for being with us. Thank you for your time.